Hello friends. Today we are going to discuss about long-acting injectable Olanzapine Pamoate. I am Dr. Suresh Padadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. This video has no conflict of interest. No person, no industry, or any pharma company has given money to make this video. This video is purely academic in nature. Let's discuss about long-acting injectable Olanzapine. When olanzapine is combined with pamoic acid, we will get olanzapine pamoate. Olanzapine pamoate is a prodrug. This needs to undergo metabolism to get the active drug. Hence, olanzapine pamoate is injected into the body. This olanzapine pamoate has a microcrystal suspended in a sterile aqueous solution. These are the microcrystal where olanzapine is inside it. These crystals need to be broken down through the enzymatic action of the body. Then, active olanzapine is released into the blood. Peak plasma concentration appears within 2 to 6 days. Apparent half-life is 30 days. Steady state levels are reached in approximately 3 months. Long-acting olanzapine are available in the 3 dosage form: 210 mg vial, 300 mg, and 405 mg vial. There is no need to give concomitant oral olanzapine when you start injection. You can advise to stop abrupt stoppage of olanzapine is recommended. Please remember, when you give olanzapine pamoate or that long-acting olanzapine, the first 4 dosage is given every 15 days once. After the 4 dosage, you will shift them into the next higher dosage, once a month injection. Let's understand this. If you look at this table, the first column is oral olanzapine converted into injectable olanzapine. First 4 dosage, that is first day, 15th day, 30th day, and 45th day. It is given once fortnightly. After the 4th dosage, you will shift to the next higher dosage and you will give monthly once injection. Let's understand by giving. If a patient is on 10 mg of oral olanzapine, you will stop that and you will give 210 mg olanzapine injection IM on the first day. You will repeat this on 15th day, 30th day, and 45th day. The next higher dosage is 300 mg. On 60th day onwards, every month we will give 300 mg. Suppose if the patient is on 15 mg of olanzapine orally, you will stop that medicine and you will give 300 mg every fortnightly. That is, first day, 15th, 30th, and 45th day, you will give 300 mg every fortnightly. After the 4th dosage, you will shift to 405 mg per month and you will continue that. If the patient is on 20 mg oral olanzapine, in such a scenario, you will give 405 mg of olanzapine every fortnightly for next 2 months. After that, monthly you will be giving it. So my dear friends, please remember this. You need not give concomitant oral olanzapine. First 4 dosage is every 15 days. After the 4th dosage, you will give every month the next higher dosage. What are the side effects of olanzapine injections? Pain at the injection site, weight gain, metabolic syndrome such as glucose intolerance test, dyslipidemia, constipation, sedation, palpitation, extrapyramidal symptoms is very rare. Post-injection delirium or sedation syndrome is well known. Let's discuss about post-injection delirium or sedation syndrome. Once you give injection olanzapine pamoate, you need to observe the patient The main reason is if by chance olanzapine pamoate is pushed into the IV or else intraarterial or else even the bleeding occurs intramuscularly when you give this olanzapine pamoate suddenly start dissolving and olanzapine will be released rapidly into the blood, reaching supratherapeutic levels of olanzapine and causing toxicity. This toxicity of olanzapine pamoate is called as post-injection delirium or sedation syndrome. Hence, whenever olanzapine pamoate injection is given, it is mandatory to observe the patient for 3 hours. And whenever you give injection, you need to introduce the needle into the IM, withdraw the plunger and see whether the needle is there in the IM or IV or intraarterial. If there is no blood dosing, then only you have to push olanzapine pamoate. By chance, if you push into IV or else if there is a bleeding at the IM site, there is a high possibility post-injection delirium or sedation syndrome will occur. What are the signs and symptoms? Sedation, agitation, confusion, tachycardia, EPS, ataxia, visual hallucination, irrelevant speech. Patient do not respond and they will respond only to the painful stimuli, and disorientation, altered sensorium are very common. How to manage? You need to observe the patient. Once you give olanzapine pamoate at least for 3 hours, high index of suspicion has to be raised. If the patient has received olanzapine injection and he goes into delirium, then of course it is olanzapine pamoate. However, you need to rule out other causes of delirium. Hence, you may have to do CT scan, EEG, ECG, TPR and BP monitoring. Please don't forget to do illegal drug scanning, especially in the urine. Many patients who are abusing drugs and once they receive olanzapine pamoate, there is high possibility they will go into high sedation or else delirium. Hence, you need to rule out other causes of delirium. What is the treatment? Treatment is symptomatic. For agitation, irritability, you need to give benzodiazepine. If the patient is having EPS, please do give trihexyphenidyl. Monitoring vitals is essential. Hence, monitor TPR, BP, and input-output chart. Usually, this delirium will resolve in 2 to 4 days. Hence, you need to admit the patient inside the ward if the patient develops post-injection delirium or sedation syndrome and need to observe for 4 days. Usually, this post-injection delirium occurs in 0.07% of injection received patients. Hence, it is advisable to do pre and post injection assessment with HMSE is advisable. And also, you need to observe the patient for 3 hours after giving the olanzapine pamoate injection. With regard to the study which is done by Sandeep Grover and his colleagues in 2020, published in Indian Journal of Psychological Medicine with regard to olanzapine pamoate use of schizophrenia, retrospective records-based study from tertiary center. In this study, they looked into the 40 patients who are receiving the olanzapine pamoate. They concluded by telling that there is lack of data with regard to olanzapine pamoate in India. This study followed up with the mean 37 months of olanzapine long-acting injectable. The present study suggested that clinicians preferred to use olanzapine depot if the patient had a past history of good response to olanzapine medication orally, but he has stopped this medication because of various reasons. It may be poor compliance, poor adherence, or else lack of insight. Hence, in those patients who had responded to olanzapine orally and stopped medication, in those patients, the psychiatrist chose to give olanzapine pamoate injection. To conclude, my dear friends, Olanzapine is safe and well tolerated depot preparation. The most frequently used dosage is starting is Olanzapine 300 mg every fortnightly for 4 weeks, and then after 4 weeks you need to give 405 mg every month. The safety profile of long acting Olanzapine is similar to oral Olanzapine except the risk of post injection delirium or sedation syndrome. Hence, whenever you give long acting injectable Olanzapine, please observe the patient for 3 hours. Thank you very much for giving your valuable time. Stay safe.